So Eric, let's take a look at these numbers and bring everyone up to date on exactly where we are today. Today, we're reporting 2,015 new cases in Ohio. It was not long ago, excuse me, it was not long ago that we were at 1,000 cases a day and trending downward. As we can see from our 21-day trend chart, our numbers continue to rise at a rate that should concern all of us. We have 216 new hospitalizations reported in the past 24 hours. It's the highest number of hospitalizations we've ever reported, and it's over 50 hospitalizations more than the previous high that was back in July. In addition to that, we now have more people who have COVID who are in our hospitals, in the hospital beds than any other time during this pandemic. The higher numbers than ever before coming in, and more actually in beds in hospitals today than we've seen during this entire pandemic. Tragically, we've also have 8 deaths reported since yesterday and 36 new ICU admissions. Eric, let's go to the top 88 counties. Here is the full list of all 88 counties by case rate per 100,000. And as you will see, some of the top numbers are just staggering. Those are 4 times what the CDC says is a high incidence rate. So the virus is just running rampant in some of these top counties. On this version of the chart, we have shaded in blue all the counties that meet the CDC's definition of high incidence. So if you look at that, everything that is blue is high incidence. As a reminder, high incident counties are ones with a case rate of more than 100 cases per 100,000 population in the past 2 weeks. Currently, 69 of our 88 counties are now considered high incidence counties. As always, these slides will be posted to our coronavirus.ohio.gov website if you would like to take a closer look at the list. Let's move to the top 20. We have 20 counties with the highest case rate per 100,000 population during the past couple of weeks. And again, as we look at these with Putnam at a rate that we've never seen before, Auglaize we've never really seen any rate that high. So up at Putnam, you're almost 5 times what the CDC incidence is. And as we go down with these counties, these are just literally shocking numbers. And I think the thing that we have to remember is that these numbers will not change unless we change, unless we do things. We can change the numbers, but automatically they will simply not change. Let's take a look at the data from some of our nearby states. And what we have done is kind of done a timeline. You can see Ohio is mapped out a little bit in here. You can see our neighboring states, and you can also see Illinois and Wisconsin. And what we wanted to do is just look at these, how they were. This is October 4th, October 11th, October 18th. And as we look at these Sundays, we can see a rather dramatic change. And what you're seeing is there is certainly a change all throughout the region, and you can see how this is changing. These maps show the case rate per 100,000 population by county over the past few weeks. The counties in green and yellow have relatively low case rates, while the counties in orange and red have higher case rates. As we see for the past 3 weeks, cases have increased throughout the Midwest. 3 Sundays ago, we saw a lot of counties at a very high case level in Wisconsin, but the rest of the Midwest does not look nearly so bad. As we look at 2 Sundays ago, though, we could see more counties move into the orange level, and then trends continue into this past Sunday. While we do know that there's some spread from neighboring states, there certainly is also significant spread among counties, between counties, as residents move about. But I just thought that was kind of interesting just to see how this is in fact moving.